Hello, I'm Donal Macaulay and welcome to this BMJLeader conversation. Today I'm talking to James Mountford, who's the actual editor of BMJLeader, but he has many other roles. James, you have a most unusual career trajectory. Tell us what you do now and how you got there.
My initial job after graduating was as a junior doctor. And then I did a spell in consulting because I was really, although I didn't express it at the time, I was frustrated at the lack of organization and operational management, clinical leadership in general, good links between teamwork, between managers and clinicians at the heart of getting a patient through a pathway. But I didn't learn any of that stuff at medical school or formally as a junior doctor. That led me into consulting with a very simple logic, which was being a doctor is about helping and fixing issues with patients and their families. And being a consultant is doing that with organizations. And through that, I learned a little bit about what I would call organization, operations management, teamwork, insight into why people do stuff, and hopefully how we can better lead and manage. And then I was absolutely fortunate to get a Harkness Fellowship with the Health Foundation and the Commonwealth Fund. And I actually saw this stuff real life in organizations in the US, the sorts of ones that we hear about here. I was able to go and study, so the Veterans Association, Kaiser Permanente, Cleveland Clinic, and see how they were bringing all of these principles into their culture and the daily experience of their staff and the benefit of their patients. And living in America, in Boston, Jenny and I had just got married. She's a breast surgeon and was doing a fellowship in breast surgery. So it was just a wonderful time for both of us personally and professionally. And I'd say one other thing, which is that it was really only on leaving the UK and seeing a system that thinks about health and organizes around health very differently that I truly appreciated some of the things that we might take for granted about the NHS. Obviously, there's lots of different options between how to organize your health system between the UK's and the US's, but that no one here worries about losing their coverage, for example, or paying their medical bills. You sort of take that for granted because it's so deeply embedded in our system. Just to bring you then up to speed, after that, I worked one of the early people into UCLPartners that became one of the academic health science networks. And then for a number of years, I was at the Royal Free as the director of quality. We were building improvement capacity into our, I would say, daily work, and making that a natural part of how essential to how work is done for everybody at the Free. I had an extraordinary experience early in COVID building the Nightingale Field Hospital down at the Excel, and then spent time in the centre of our system in NHS England as the Director of National Improvement Strategy. And now my day job is in health education for a group called Galileo Global Education, which runs around 60 universities and colleges around the world, and has a big push into health professional education. So it's about growing the number of people internationally training as health professionals and equipping them with, if you like, the attitudes and the skills that they'll need to meet the need and have a successful career in the years ahead rather than the years gone by.
Now, let me take you back a little bit because you worked with IHI in Boston. That's a remarkable organization. Tell us about your experience with them.
Well, that was in 2005. And nearly 20 years on, I'm still, as are the other people, by and large, who did fellowship with me at IHI, still quite attached to both working in improvement and attached to the IHI. So what I found in IHI, which is, I mean, for people who don't know it, it's not very big. It was, when I was there, around 100 staff. I think it's a little bit bigger now. It has effectively virtual branch offices, but its center is in Boston, and it certainly had a disproportionate impact on improvement in the UK, in England, Scotland, Wales, and Northern Ireland, and other countries. And its founder is a truly wonderful pediatrician called Don Berwick, and plenty of people who've heard of Don haven't heard perhaps of IHI. But really what IHI does and believes, I suppose, is that the principles of management of variation and process in a way that understands reliability can be applied to the delivery of healthcare in the same way that they can be applied to better industrial performance in the production of cars or the industrial base where the theories were born. And then if we bring it then up to date with perhaps a more human lens, it would be about the science, I'll say, of things like joy in work, kindness, what matters to you, the human dimension of these linked to getting better performance. And performance is an underused word and perhaps a dirty word in certain health circles. What I mean by performance is results in a balanced way that matter across something like the quadruple A, rather than performance in a really reductionist way, which is, are you balancing your books? Are you hitting a weighting target? It's much broader than that. It's doing well for every pound you spend across all the dimensions that matter, and doing better tomorrow than you are today.
Now you bring it back to the UK because you worked with another organisation, the Advancing Quality Alliance.
So for a number of years, I had the privilege to be a non-exec at Aqua, Advancing Quality Alliance, based in the Northwest. Aqua, again, I mean, it has, if you like, intellectual roots in improvement and relationship roots that trace to IHI through some of the founders, David Fillingham, David Dalton. I guess, without sounding, with trying not to sound flippant, Aqua is trying to do some stuff that I think people who are from outside of our system might imagine would happen routinely and as normal, which is collaboration across different parts of the NHS, intellectually but also practically, around big challenges. So issues around mental health care and safeguarding, issues around patient safety, issues around flow, collaborating across the Northwest to make progress on those. And when I say collaborative, people who do know the IHI or the Aqua way would know that there's there's the concept of collaboration, but there's also specific tools and methods of running distributed collaboratives, which are trying again to maximize the efficacy of the learning and the results that each node in the collaborative gets. I'm particularly delighted that it must have been about 12, 13 years ago that I joined Aqua's board, and I'm still in close touch with it, and its CEO is my very good friend and colleague, Sue Holden, who I got to know in NHS England. And I'm really pleased that Aqua has now got a footprint that expands not just in the northwest of England, but internationally. And that's something that Sue has been championing.
So you've spoken about collaboration and you've spoken in an international context. So that brings us right up to date, because Galileo is a truly international organization. Tell me what you do with Galileo.
So we're trying to grow our footprint in health professional education. So the ambition is to have 100,000 students internationally by 2030 studying for health professional degrees around the world. At the moment, we're at 12,500 across 7 schools, different professions, different continents. There are 7 countries where people are studying for health degrees within Galileo. Just to give a comparator, if you like, there's 60 universities and colleges and 250,000 students in total. So at the moment, health is about 5% of that, but we want it to grow to become a third pillar, if you like, a third leg, with equivalence to the main existing areas of creative arts and design and business management. So my job is quite simple to describe, in the sense that we're trying to grow from what we've got. So we've got medical schools, physiotherapy schools, nursing schools. Our university in Cyprus has just learned that it is licensed to operate veterinary medicine, starting soon to go with dentistry and the other things, 13 health professions in total. So it's about helping those schools to learn from each other and to grow new courses, new campuses, grow the number of students, and if you like, they're fit for the jobs that they need to do, and also grow the number of institutions that are part of Galileo. So that's partnerships or acquisitions with existing schools internationally.
So listening to this fascinating career trajectory, which brought you to the US and has brought you to this international organization around the world, for someone listening, if they wanted to follow that career, what would you advise them?
Well, I guess the first thing to say is I couldn't have predicted it. So, and I don't offer this as advice. I offer it perhaps just as reflection on what I've done. But I would say that being really clear about some things and sticking to them, and being very, very flexible about others, has perhaps led to the path that I've followed. So the things that I've been clear about is I've wanted to work with people who inspire me, you know, who I find just extraordinary human beings for their values and their energy and their capacity. I mean, I mentioned Don and Sue, but I've been so lucky to work with many, many others, you know, David Fish at UCLPartners, for example, Martin Hirsch at Galileo today. So, you know, your career seems really long when you're starting on it. As you get through life, it starts to be shorter, and you start to think, you know, let's not waste time in places that I'm not adding as much as I can, and I'm not working with people who inspire me on things that I find inspiring. So this theme that goes right back to my time as a junior doctor, about, you know, how do we bring to the basic clinical knowledge and energies of clinical teams, how do we bring an organizational wrapper that allows those skills to be able to express themselves the best, which, you know, is the very, if you like, core of being a satisfied professional and giving good care to your patients and good value to whoever's funding the system. You know, cancelling lots of patients at the last minute for their operations is frustrating everybody. And that was the situation that you know, I found myself in back around 2000. So I'd say, you know, think about the causes that really matter to you. Find great people to work with them on, and then perhaps be quite flexible about the sort of organization that you're working in, or even the specific work that you're doing, and maintaining, in a sense, you know, your head down to do a good job at what you're doing, but looking to the horizon about where it might take you is perhaps looking back. That's something that I've followed, and it is endlessly fascinating.
So as part of inspiring this new generation and communicating this vision, clearly BMJLeader has a role. So where do you see the role of BMJLeader itself?
So we want BMJLeader, which is one of the relatively few journals within BMJ's stable that cuts across. So most of them are, if you like, specialty journals in cardiology or ophthalmology or emergency medicine, sports medicine. So we cut across that, and we want to be the place for academic research and investigation and debate around the topics that matter to do with leading and managing well in the arena of modern health systems. We want to do that internationally. So we don't, I say often that each letter is wrong. B, we don't want just to be British. M, we don't just want to be medical. And J, we are more than a journal. We have lots of blogs and events and things. So I think, to answer your question after that orientation, in some ways we do behave like a classic journal, publishing, I hope, high quality, methodologically rigorous, often social science-based research into leading and managing in health systems. But we also want to signal priorities and need in areas that matter to us as a team. So I think one of the things I've done as an editor is to broaden and diversify that editorial team, diversify it geographically. So when we started, everyone was based in the UK, and a doctor, and a man actually, on the editor side, not on the publishing side, but we've diversified in terms of the usual dimensions and the professional dimensions. So we've got people who are managers, who are allied health professionals, nurses, etc., into the team. And then to try to focus on areas which are particularly germane or fast moving. So we had a special focus and a special topic collection on equity, diversity, inclusion, and social justice. We just published an editorial on kindness and human connection that we want to use to launch BMJLeader into exploring further that area. I suppose there's a fundamental belief among a number of us that the act of giving and receiving healthcare is fundamentally human, and in how we lead and manage, we often lose the sense of that connection. And as people go through formal training, they become less empathetic. Good evidence for that. Well, how can that possibly be a good idea? So build a team, shine a light into areas that we think are worth exploring. Some others are, for example, digital. Healthcare is happily, and health, revolutionizing around digital. We're also looking geographically with a particular focus coming up on Africa, and something that affects us all in different ways, sustainability. So how do we lead for sustainability? So I would like BMJLeader to not just be a place that academic experts or senior leaders want to go, but people who are curious about how they could play a bigger part in helping turn lots of effort and resource into good results for patients, which is what managing and leading is about. So I'm really pleased that we've got fellows on the team. I'm really pleased that we're doing all sorts of stuff, Twitter chats, book reviews, events, working with FMLM, our co-owners, and stuff that's aimed at students and people earlier in their careers. Effectively, what I'm saying is we want BMJLeader to be dynamic and very broad in terms of how it focuses on this challenge of helping people lead and manage better in health services.
In describing BMJLeader, you described the editor in its dynamism and in its breadth of vision. And in that breadth of vision, you have a contribution in humanitarian aid. Tell me about your humanitarian contribution.
A cause that I think has touched many of us, and certainly me, and it feels very, very live. We're here on 2 years after the Russian invasion of Ukraine. I, 2 years ago, was completely just appalled, shocked at all sorts of levels at the pictures we were seeing, and I wanted to do something other than send tweets and have conversations with friends about how awful it was. And that opportunity to do something came to me through the timing of a job transition, the reconnection to an old colleague who happened to be just the other side of the channel, and really got into action very quickly. And by mid-March, had welcomed 50, then 100, and then around 300 Ukrainians into the local community around Saint-Omer in the north of France. And I was volunteering with Solidarité Ukraine, which was this grassroots organization that my friend Mary had founded, mobilizing her local community and all sorts of other resources, host families, social housing, teaching and learning French, helping these folks who had arrived in the community to first feel safe and be safe. I hadn't really thought about, before I went, the connections between the day jobs and what I was doing now in an area that was clearly relevant to health, but felt rather different to what I had previously been doing. But they were there. They were very visibly there.
James, thank you very much for sharing your life, your ambitions for BMJLeader, your life as a leader yourself, and of course, your humanitarian contribution. Thank you very much indeed.